Welcome to the Nurses Out Loud radio show. We will be starting in a few moments, so please stay tuned. If you are watching on social media, please give us a like, share, and follow. And for those of you who would like some more info, please go check us out at nursesoutloud.com. Thank you.
We were taught to trust the schedule, to follow orders, to stay in line. But what happens when you start asking questions and the answers don't add up? Today, I'm joined by someone who's done what few are willing to do. Dig into the data, page by page, study by study, and build a resource that empowers parents and challenges the system. Dr. Christina Parks earned her Ph.D. in cellular and molecular biology from the University of Michigan. She's a nationally known scientist and speaker who's been boldly standing for medical freedom, exposing the truth about the COVID vaccination campaign and the vaccines on the childhood schedule. Her passion is identifying the root causes that throw our bodies out of balance, causing dysfunction and disease, and teaching us how to restore health in an age of toxic overload and chronic illness. She's also the founder of the Vaccine Injury Teaching Alliance, or vi-ta.org, a website that breaks down every childhood vaccine with full references so parents and healthcare providers can make informed decisions. This isn't about fear. It's about facts. And if we're serious about ethical nursing care, conversations like this are no longer optional. They're urgent. Dr. Parks, welcome to Nurses Out Loud.
Thank you so much for having me.
Yes, I'm so happy. I remember seeing you, and I don't remember what year it was, but I want to say that it was very early on.
It was 91 when the video went viral about I was testifying in front of the Michigan House on vaccine mandates.
Yes, what year was that?
August of 2021.
Mm-hmm. Yep. And I saw you and I was like, oh my gosh, I love her. I love her. I was cheering him.
That made me go viral because they were in there because the mandates affected them the most. And they were like, that was so good. And actually a homeschooling mom friend of mine actually clipped it because it was 4 hours long. The whole thing was, and put it up on YouTube without my name on it. And the nurses are the ones that started spreading it among themselves and caused it to go viral. So I thank you, all you nurses.
Yes, I was definitely one of them. I was like, listen to her. Like, she knows what she's talking about. I mean, at a time when courage was so rare, that was really empowering and uplifting. Actually, a month later, I blew the whistle publicly to the world. So yeah, you were definitely an inspiration in that as well. So thank you. All right. Well, let's start by hearing your story. I mean, what led you to speak out? What led you to speak out that day?
Oh, that was just another day. I was just so censored. Nobody knew I was speaking out. I was speaking out all over the place. I was going to all kinds of political rallies in Michigan. Someone would ask me to speak and I'd be like, there's no PR on this. Like, nobody's going to be here. I'd walk in and there'd be like 400 people. And there were like all these underground networks of people who had just had it. And it was because I had been researching COVID since December. You know, is this real? When it was in China, hydroxychloroquine. And so I knew hydroxychloroquine worked. I had gone to all the basic science papers. And I just needed to let people know. It was never a question for me, ever. There were a couple of things I was afraid if I said I might get, assassinated or something. But I was like, well, I guess we'll find out.
Yeah. So, I mean, what was the like a personal, professional turning point that opened your eyes to how broken this system really is? I mean, did you learn this in your education? Was this after?
Well, I think scientists just look at things very different than doctors. As a scientist is very I would have a hard time being a doctor and just be like, "Here, take this drug." I'm like, "Do you know how complicated the human body is and like how everybody's different?" And so, we used to have a sign on our research doors that said if we knew what we were doing, it wouldn't be called research. So I actually got my PhD in an immunology lab. We were still cloning the immune receptors, and kids were getting vaccines then too. So I knew that we didn't know what we were doing, and we knew that you really shouldn't vaccinate under two. So when they started adding the chickenpox to the schedule, when they started moving them under two, we were all kind of like, what are they doing? But this was back in the 90s when you could still question things. And so I remember hearing about Andrew Wakefield, and the studies were real. There were real issues with the gut, and there were subclinical gut measles infections. That was in the published literature. So I didn't understand the politics of it at that time, and I didn't understand what was really going on. But I knew that it was going to be an issue. And eventually, when I did start speaking out, parents would come to me and like tell me these long, horrifying stories and what's wrong with my kid. I know science is complex. I know that a parent knows their child. My job is to figure out from what they said what's going wrong, not to
Mhm.
tell them that doesn't exist. Our professions are in service to people,
Yeah.
right? So
Yes.
my knowledge is in service to figuring out what's going on with their child. There were years I didn't know what the mechanism of MMR might be, but I never doubted that there was a mechanism
Hmm.
of injury by the
Right.
MMR vaccine. Mhm.
So this was early on, like in the 90s that you started like questioning, or you just were you
Well, I started questioning
outspoken?
right in graduate school. And so by the time I started teaching and I started seeing a lot of neurological injury and increase in autism, and I remember I was teaching in high school and I said, uh, vaccines are going to be the issue of our day. And like I had no idea that it would get this big. I assumed that there would be enough injury and that there would be enough backlash. I didn't know about the 1986 act that basically it would be a self-correcting problem. And so to see the amount of damage that has been done, it's staggering to me. It's kind of like when they shot down hydroxychloroquine. I was physically ill. I grieved for like a month because I'm like their goal is to have millions of people die so that they scare people for whatever their agenda is, because the science on that is impeccable. And, Tony Fauci did his work on HIV, so he knows that hydroxychloroquine is a third world cure for HIV, or, treatment. I was like cure, but, so I
Yeah.
knew that they knew, and this was intentional. And, you know, my
Yeah.
job is to serve the people and give them information that they need.
That's kind of how I felt in the beginning. I was not, quote unquote, an anti-vaxxer. I mean, in February, March of 2020, um, really my street smarts just came out like, wait a second, what are we seeing here? Why are we locking down the healthy with the sick? Why are we, preventing people from earning an income, or children going to school, or parents being able to work? Daycares were closed, all of this stuff. And,
The
and I
masking,
really,
the
yeah,
masking,
the
like the
masking,
viruses are going to go through. It's like, trying to put up a fence to stop mosquitoes, like, so I was
right.
just like the masking. I was like, I thought every health professional should know that those masks don't work. And
Hmm.
so I was just like, what kind of weird game are we playing?
Yeah, because that's what it was. So that was very interesting that you felt that resonate in your spirit. I mean, really grieving. I remember in June when it really all just hit me. I literally got on my knees at
That's
my
about what it was
bedside.
for me too. It was just like, oh my gosh, they're going to let all of these people die. We could have given everybody hydroxychloroquine at $1 a pill and shut it down. We could have just shut
Yeah.
it down.
So tell our listeners, why would hydroxychloroquine, why was that effective? What does it do?
So it stops viral replication. It's actually a very broad spectrum antiviral. And it's actually one of the most effective things against the SARS virus, the original SARS CoV-1 virus or whatever. And so they knew that. They knew that it worked. And it has a really long half-life in the body. So you only need a very, very little of it. And because it shuts down viral replication, it actually prevents transmission. And there were some studies actually showing that with nurses, mostly in like different third world countries, that those who were on it or those who are on it for different inflammatory conditions. It also reduces almost all of the predisposing factors like diabetes. It's a really great treatment for metabolic disorder, especially in people of color. So there was so much data on it. And I've been researching it since like January, so I knew. And so it's that half-life that you could use it in really low amounts and actually prevent transmission because it stays in the body about 55 days. So,
wow.
Yeah.
That's crazy that the half-life on that is so long.
I think the half-life is 26 days, but the half, it goes half and half and half. So stays in the body. So you could take it once a week or even once a month, but you could take a small dose once a week and actually prevent transmission. And hydroxychloroquine is a known anti-malarial that's handed out like candy all over the third world, or used to be, right? And pregnant women, children, like everybody. So this idea that suddenly this treatment that they're giving kids for lupus, or overseas is not safe was like, there were just all these glaring signs that this was some sort of worldwide psychological operation with some kind of nefarious intent on the other side. And I didn't know exactly what all that was, but I knew that the science told me that they were completely off base. And my goal wasn't even to like try to figure out the conspiracy theory. It was just to try to save people's lives.
Right. To let them know that there's options and stuff out there. You are a plethora of knowledge, and I am so excited that we finally have a chance to sit and talk. And my brain is just, going a mile a minute because there's so many different paths that I'd want to go down with you. But let's back up a little bit and let's talk about vaccines, okay, and the approval process of it. Can you walk us through how vaccines actually get approved? Because I really want to, speak directly to the nurses and the parents that are listening right now that don't realize the process.
Right. So I'm not a regulatory person, so I'm really the scientist, but very briefly, what they do is the manufacturer actually develops a vaccine. And then generally they test it against an already existing vaccine. And usually like maybe the one they were using before, the new MMR versus the old MMR, right? And they say, does this cause more severe adverse events than the last one? Well, the last one was tested against another one, or sometimes an experimental one. And only one case in the US was it tested against a saline, which means like water and salt, a saline placebo. So, and that was only like 200 people for one HPV vaccine. The rest are tested against other vaccines and sometimes, or the adjuvant. So they're going to inject a bunch of nanoparticulate aluminum and say, well, we saw 10 seizures with the nanoparticulate aluminum and 11 with the, so they're equal. Well, maybe it's the aluminum that's causing the seizures,
Right.
So, and so because it's done by the manufacturer and they submit the evidence to the FDA. And I have to tell you, as a scientist, it's a very high level of scientist, interacting with people, doctors, lawyers, administrative people, most people don't know the science and they're just rubber stamping this. They're just rubber stamping it.
They're trusting that the scientists actually know the science. And it's just one of those things that you just continue to create a culture of, say, safe and effective. I talk about it all the time that nurses and doctors, they don't know how vaccines get approved or the ingredients in it.
They know very little.
100%.
Because
they don't know.
Molecular biologist, I was trained in all of this, and I didn't once I started reading it, I had the foundation to put it together very quickly, but there was no explicit training in it. So I didn't know they contained aluminum. I'm like, contained aluminum? What?
Yeah. Right.
So, and so I was more familiar with the molecular biology of how, like, the COVID vaccine being experimental gene therapy, I immediately recognized the platforms. That's what I was trained on in school. So I'm like, this is experimental gene therapy. I have no question. People are like, what if you're wrong? I'm like, I'm not wrong. Like, I'm not wrong. Like, I learned this in school, And so
Yeah.
those weren't tested really at all, and certainly not on their ability to prevent transmission. And so, like,
Yes.
they take all this really complicated science and then safe and effective. And
Hmm.
I was a high school teacher, so I really see my job as a teacher to take really complex science and bring it down for the layperson, because we are in a paradigm shift of how we understand things and how we are going to support our bodies. And people need to understand, like, if you are infertile, you need to understand IVF. If you have cancer, you need to understand stem cell therapies. There are so many things that are really complicated, but the average person doesn't know how to make a decision on.
Right. And I think that is where your website, and I said that right? vi-ta.org.
Yes, vi-ta.org. Yes. And, we
Yes.
talked about this before the show. The free pages are all about vaccine information, and there's a lot of it, right? I'm trying to download everything kind of that I know to help you in layman's terms as much as I can, as well as mechanism of injury, how these might be injuring you or your child. But then behind the paywall, it's all health recovery. So it's not really just about injury from vaccines. It's really about any kind of chronic illness, because the underlying predisposing factors, whether they're environmental, diet, or, medications or vaccinations, are all the same. And the route to restore your health is to restore each of these different systems in the body that are compromised, until your body
Right.
can kind of get up enough to overcome all of it.
Yeah, it's, even listening at like root cause approach or learning about that and about like the gut brain connection. These are all new ideas that I learned after nursing school. This was my COVID education, was to learn about glutathione and, and the microbiome in your gut and how important that is, for a plethora of reasons. Like, they didn't teach that in nursing school, and I'm sure in medical school.
Right. Or in graduate school. Like, they taught all the little parts, but they didn't really put it together. I honestly think teaching high school is helpful, because you start putting all the pieces together, and then you start asking your own questions, and then you start putting it together. And now actually ChatGPT is really great, because I know what questions I want to ask, and it's able to bring me and synthesize information really quickly. So I don't have to go find every
Yes.
single paper and look it up. You always have to verify it, but I already know most of the information. And it's like taking the stuff I learned and being like, but I don't remember this. Can you remind me, kind of a thing? How does this,
Hmm.
go together? So, but yeah, I'm very much a root cause person, which is my scientific background. That's why I went into science, because I wanted to know why. I asked my sister, don't you ever want to know why a light bulb turns on? She's like, no. I'm like, oh,
Right.
okay. I thought
You're like, well,
everybody
I
was
do.
interested in things like that. Yeah, I do. That's why I'm a scientist.
Right. Right.
Just keep asking
Well,
one question after another.
so what shocked you most about the childhood schedule when you did look at the pre-licensing safety testing for vaccines?
What shocked me the most? It just kept getting the deeper you look, the worse it got. The deeper you
Hmm.
look, the worse it got. And it's like everybody probably knows, well, there's this little problem with this or this little problem with that. But when you start compounding all of these things, and the fact that, I think it really shocked me that they found out in 2002 that the MMR was causing autism in Black boys, and they shredded the data and they did nothing about it. But in fact, a researcher at Mayo Clinic actually looked into it, and he found genetic predispositions, especially in those of like Ethiopian and, North Eastern African descent, which my children are Ethiopian. So I'm like, I ain't giving them an MMR vaccine. They have different immune systems. Their immune systems respond 4 times greater immune response. So they need like half or quarter of the dose. So these are things that could have been addressed and optimized. And instead, they chose to be cowards and hide them and damage our children. So I guess the extent of the cowardice, and you were saying I'm one of the only people that stands up, the
Yeah.
extent of the cowardice in people we know and in people at high levels to actually face an issue head on.
Mm-hmm.
Uh, despite the consequences, it's just not there. And
Yeah.
it's destroying our world.
Yeah, 100%. I think, I tell people all the time, it's like, it's my faith, it's my faith in Yeshua that helps me to realize that I am a child of God that's living in the world right
Mhm.
now. You know what I mean? And
Right.
that this is
Absolutely.
just a journey that I'm on right now. And it's very, very short. And one day I am going to meet him and have to account for everything that I have said and done. And one of those will not be, oh, I heard you talking to me. I felt that little whisper, that nudging. I knew that you were guiding me to do this and this and this. But Father, I had to collect a paycheck. There's no way I could have said that, or I refuse to say that. And there's so many people that live in the world and don't realize, that like their boats and their cars and all of that. I mean, Dr. Parks, I would have went back to serving, you know what I mean?
Oh yeah.
Then continue in a system that, then not speak out against the system.
But here's what nobody tells you. Like maybe those people look like their lives are okay compared to us. We were talking about this before, trying to pay the bills while we do so much for free, right?
Right.
But it costs you your soul. And I really feel that your soul dies when you don't stand up. Conversely, almost every one of you know that I know, like I know the most amazing people on earth. I mean, really, the people that we know are truly amazing people. And actually, I feel that my life is flourishing, right?
Mm-hmm.
Do I have like all kinds of expensive things? No, that's not what I mean. I still can't afford a house payment, but my soul is flourishing, my life is flourishing, my relationships are flourishing, because when you shut down your soul and what God's calling you to do, it's death right here on earth.
Yep. That's where the anxiety kicks in. That's where the depression, kicks in, all of that. And yeah. Oh my gosh, we could do a whole segment on courage and, and speaking up. All right, let's talk about this. So the VAERS reporting, okay, that is something that we are legally bound as healthcare providers to report to the system. But what happens when you don't recognize that there's a safety signal, right? If you don't recognize that the vaccine could have caused it, then of course you're not reporting it. What do you think about the VAERS system in general?
Well, I mean, I think it's good to have a system that sort of tracks things. But of course, the Harvard Pilgrim study that the CDC actually went to Harvard medical system and said, hey, we want an active thing, that we're all computerized. So we should have practitioners enter this and it'll just go through the system automatically. And when they started making this system that tracked it better automatically, they found that vaccine injuries were 100 times more prevalent than they had previously been, than the VAERS reporting system. So Harvard Pilgrim Medical System actually reached out to the CDC and the VAERS people and never heard back from them.
Yeah.
So we don't have it. That's why we don't have an active reporting system. But I actually kind of have a little bit of a problem with the epidemiology, because people want to argue about the epidemiology. And you can do that because it's really easy to twist statistics. What isn't easy to twist is a mother's eyewitness account and the biological, biochemical mechanism. So people try to tell me this, that, and the other, and I'm like, we have biochemical mechanism. This ball hits this ball that hits that target. Like, we know what happens. And that is especially the case with the aluminum. And that's why I published my website, especially like with the aluminum. Here are all the studies. Now, it takes like a molecular biologist to put the studies together. There isn't a study that says this happens. You have to know the pieces and the parts. And so you have to be able to explain it. That's why it's science, right? And that's why scientists educate doctors on mechanism. But we have the mechanisms now. So you don't need the epidemiology when you know how it happens, and that's where like the glutathione comes in. Then it's time to address it and fix the problem.
Right. Well, on the second half here, guys, when we come back from break, we are going to talk about glutathione, acetaminophen, Tylenol, same thing, and the science of it behind it all. I think it's really important to touch on that. And so, guys, you are listening to Nurses Out Loud. We are on air 5 days a week on iHeartRadio, as well as all of the podcast apps, and the video portions of our shows are on Rumble. So I encourage you guys to go to Rumble, follow Nurses Out Loud over there, and also subscribe to our Substack. If you go to substack.com, Nurses Out Loud, you will find us and you will get reminders whenever a new show drops. And so we really love to hear from you guys. You can do so on all of our platforms. Like, share, comment. This is how it gets in front of more people and we can educate. Again, you know, this is mission driven. This is something that we feel called to do. And we have been doing it faithfully for the last 5 years. So please like, comment, share, send us your emails. And also support AmericaOutloud.news. You can find 24/7 programming if you download the America Out Loud Talk Radio app. And if you go to AmericaOutloud.shop, you can find our family of sponsors and receive exclusive discounts only available to America Out Loud Talk Radio listeners. And so we will be right back after the break.
If you are a nurse that is fed up with the sick care model, I have a solution for you. My name is Melissa Schreitfetter, and I am the owner and founder of the Functional Nurse Academy. FNA is the most comprehensive functional medicine training program on the market, specifically tailored to nurses. It is self-paced and equips LPNs, RNs, and nurse practitioners to practice functional medicine, address the root causes of dysfunction, and start their independent functional medicine practices. At FNA, you will learn how to order labs, functional health reports, create customized wellness plans, package and price your services, and even how to market your brand effectively. Graduates earn 90 nursing CEUs, and then they qualify for multiple board certification titles. They also will have access to our exclusive tools, such as our Functional Nurse Toolkit, our social media and marketing kit. And I don't want to just train you and send you on your way. So you also will get access to me each month via the Functional Nurse Academy monthly mentorship program, where you will be able to attend a live class with me each month. So say goodbye to sick care and start your dream career as a functional medicine nurse. Enroll today at functionalnurseacademy.com.
All right, guys, welcome back. Thank you for joining me. I am your host, Nurse Jody O'Malley, and I am joined today with Dr. Christina Parks. And we're going to pick up this second half talking about glutathione. So let's dive a little deeper into that. I will say, as a nurse, I never heard about glutathione until COVID. And I started, listening to quote unquote alternative people, the ones that actually did the research. So yeah. So what is it, Dr. Parks, and why is it so critical for health?
So it turns out that your body has actually a system that's designed in you to actually keep you young, to turn on genes that protect, that mop up free radicals. So many of you've heard of oxidative stress or free radicals. You may not know what that means, but they're kind of like little electrons or little bullets that hit your tissues and damage them. And they're made by your mitochondria when you make energy. So anything that you do, including exercises, produces them. When you have an infection or when you eat too much garbage, or you have toxins, you're going to make a lot more of them. So your body has certain systems, certain gene systems that are turned on that actually make enzymes like superoxide dismutase and catalase that mop those free radicals up. But they also have pathways that make glutathione, and that is your body's master antioxidant detox molecule. It's actually a really simple molecule, but what it does is it mops up free radicals, but it also binds to toxins and kind of pulls them out of the body. And when Tylenol breaks down in the body, glutathione binds to those breakdown products and safely pulls them out of the body. But if you use a lot of Tylenol, it uses up your glutathione, not allowing it to mop up free radicals or detox other chemicals. And this is why, like, if you are under treatment, like in the hospital or something, and they give you a lot of different medications, you can really be taxing your liver and your glutathione stores, because it's using, a lot of those might be using glutathione for your body to detox them out of your body. So it keeps inflammation low. And when your levels get critically low, I'm going to relate it to COVID now, in your immune cells in your lungs, what happens is those immune cells in your lungs, when they lack enough glutathione, they actually sort of blow up and they release inflammatory cytokines that cause huge amounts of inflammation in the lungs. And that's what they were seeing during COVID. They were kind of thinking it was from the infection, but it was from low glutathione, these cells blowing up, releasing inflammatory cytokines, which causes more immune cells to come in and do the same thing. And it was causing this hyper inflammation of the lungs. IVs with glutathione and vitamin C could have, really prevented and reversed a lot of that. Very, very simple, because it turns out that vitamin C actually helps your body recycle glutathione. So these are the kind of things, whether it's during COVID, or let's say you take your child for a well child visit and they're screaming because infants have very, very low amounts of glutathione. So like, let's say maybe you gave them antibiotics, or you had an infection, or they had an infection, or they just have low, amounts anyway. And you have a well child visit, that baby's stores are depleted critically. One dose of vitamin C, whether you take it and you're nursing and you give it through nursing, or just like they have powder that you can give it a couple of drops in some water in their mouth, could actually prevent them from having SIDS. Because guess what? Glutathione is so critical to your health. When it is completely depleted, you pass away. So you see many infants that within the first week they have a severe vaccine adverse reaction, but you also see it at 3 weeks. And a lot of those kids kind of go up and down. They peak a fever, they get lethargic, they kind of throw up, then they seem okay. And it might be what they're eating, a little bit of vitamin C here, they start to recover. And then eventually their levels are so depleted, if they're not restored, that they can actually pass away or have like a scurvy-like reaction where they have brain bleeds, and they can bleed at their epiphyseal plates. They can bleed because all of your collagen production is dependent on vitamin C and glutathione. So when they have critically low stores, it could actually look like shaken baby syndrome, where they have brain bleeds, retinal bleeds, all of these other things. And a dose or two of vitamin C. So I actually had someone that reached out to me 3 weeks after a 6-in-1 vaccination and 2 other vaccines. This child had a brain bleed, a spinal column bleed, retinal bleeds. And they wanted to charge the caregiver with shaken baby syndrome. And the family was like, we don't think it's the caregiver. We think it's the injections. Can you write a biochemical mechanism? So I went through all of the different medical records, and it showed that the first thing was they thought the kid had a lung infection, right? Wow. Those cells degranulating and causing inflammation. So then, of course, they give antibiotics or whatever. Then the kid was lethargic. Then he started puking. So all of this happened prior to the incident where the child had the brain bleed. Then I had probably, I don't even know, said, is she nursing? Tell her to supplement with vitamin C, vitamin D, vitamin A. Mom did. And that baby made a really good recovery. That baby was expected to basically be a vegetable for life. And they showed me a video of the little boy running around at 1 year old. And so, but what this highlights is our doctors don't know this. As you know, as a nurse, you can shut down this sort of septic reaction of these inflammatory cytokines with an interleukin-6 blocker. We have the tools to shut down these vaccine injuries before they irreversibly damage our children.
Right. And that's why it's important to recognize that this could be occurring. Right.
Right. Exactly.
So talk us through, like a mom, going to the well child visit. I remember, so my doctor, even when my 2 oldest kids are 34 and 30. They always told me, do not take anything. Basically, don't take anything while you're pregnant. Okay.
Yeah.
So I never did. With my youngest son, his pediatrician, he'll be 16 here soon. He told me not to even medicate for a fever other than 104 or higher.
Right.
He
exactly.
told me not to even medicate.
Mm-hmm.
So there's a lot of parents that I've been hearing where they say, give them Tylenol before they go in for their well child visits.
Right. So then you're depleting the glutathione. Then you have an acute immune activation from the vaccination, which it also depletes glutathione, right? So, and if they have a high toxic load, our kids are way more toxic than we were just because of all the chemicals in our environment, if they had an infection, it just depends on all of their circumstances, on their genetic markers. So there's something called the methylation cycle. And part of the job of the methylation cycle is to produce glutathione. If you have certain variants, you may not do it very effectively. And so if you have a predisposing genetic background on top of these other elements, you are going to be more likely to have an adverse reaction, right? And the depletion of glutathione. So, I mean, there are other things involved and other mechanisms involved, but that is one of the most key things that, and here's the thing, when I was looking up SIDS, it is actually these children going septic. And as they're going septic, it actually affects the cardiorespiratory centers in their brain. And the prostaglandins and some of the other things actually kind of shut those down. And so as a result of starting to go septic, they actually stop breathing. And so that can lead to SIDS. Now, a lot of times in premature infants, they see these incidents already, but then when they vaccinate, it goes way up. The incidence of it goes way up. A lot of times they have a crash cart to keep the child alive there. But like, why are you inducing a child to go septic? And they actually did the studies because they were like, oh, it must be a bacterial infection. And someone said, well, the vaccines actually activate the immune system. Maybe it's them. And they studied, and sure enough, it was the vaccines that were inducing this septic-like condition that was causing cardiorespiratory arrest in these premature infants.
Well, and I'll even talk about, I had a patient not too long ago, came in on a holiday morning, found the baby who was 6 months old, lifeless in the crib. The parent told me that they were just discharged from the children's hospital that morning, that or the day before, that the child was in there for pneumonia, but was able to go home and was fine. And then, few hours later, they're not alive anymore.
And I do want to make this clear. There can be many factors involved. So there are other genetic mutations, like some ion channelopathies that are associated with SIDS. So I'm not that person who's like, only vaccines ever cause, autism or whatever. And, and I think the biochemical mechanisms that I've explain that. But what if they had given that child some vitamin C, or what if mom was taking it? And so you're talking about not treating a fever. Well, you can treat a fever. You can take an Epsom salt bath, which the sulfur in it increases your glutathione. You can take some vitamin C, which helps your body recycle glutathione. You can take vitamin D, which is anti-inflammatory and helps to bring your immune system back into balance. You can take vitamin A that does the same thing. You can nebulize a dilute solution of hydrogen peroxide or iodine, which actually decreases viral load. So and I knew kind of about some of these, but I wasn't doing any of these prior to COVID. And during COVID, I started doing all of them. And I'm like, why have we ever been running to the store for cold medicine? Like, I feel like a freaking moron.
Same. I cannot tell you. Basically, everything that you just said is something that I've already been using because of my eyes being, opened up. Yeah. So let me ask you a question. In the ER, a lot of doctors, for pain management, they order 1,000 milligram Tylenol IV, acetaminophen IV, right? It goes in over 15 minutes into their IV. What's your thought about that?
That's a terrible idea. I don't know. There's probably opiates that are safer. I don't know. But I'm not a doctor. So there's different, there are many different factors that are going into this. And obviously we don't want people to be in pain. But what really bothers me is if they also included like some vitamin C And, I know, and the thing is, as a nurse, that sepsis is one of the biggest problems. And, Dr. Paul Merrick pioneered a treatment or that basically was vitamin C and some glucocorticoids, some low dose steroids, and thiamine that actually really reduce the sepsis in the body. So, I mean, we need, like, the doctors need to figure that component out to support the body during all of these processes, because people die during surgery. They die in response to anesthesia. What if we were actually supporting their body? And they're always like, well, don't take any supplements before you have surgery. And like, I understand you don't want blood thinners and things like that, but and that's where, like, as a scientist, it's so frustrating because I don't want to just tell people, well, you should do this. Well, I don't know. In real world, things work differently. That's why nurses are amazing, because they actually get to see what happens when you do this, this happens. And they're the ones that tell mom, you don't want to do that. I don't care what the doctor says. Like, my experience is. And so, so we need to actually have someone figure out what, during these surgical things. But when we have these tools and they're not even being tried yet, so we need to incorporate them into our current medical care and treatment. And I think that we would see, and instead they bring you like chocolate cake to eat, which of course,
oh yes,
depletes glutathione and, deplete,
they
depletes your immune system and.
Yeah. I mean, we have a lot of doctors. I mean, it was through COVID, even in practice today where, you suggest some vitamin C and vitamin D and they're like, it's not going to do anything. They're just going to pee it out. And I'm like, oh my gosh. I mean, I remember one doctor at my hospital that I blew the whistle at, he put everybody on vitamin D and vitamin C and zinc. And I remember when my coworker got up to the floor, she was basically one of the only people that were on it, because that doctor is the only one that really prescribed those types of supplements to an inpatient. The rest of them laughed at it. And it's like, I mean, I learned that,
the
like,
arrogance of that as a scientist, I'm like, you really think you know something? I mean, like, you are so arrogant to think that, like, like, and so because as a PhD student, I taught doctors like cell biology and stuff, and like I was like, you guys really don't know very much about any of that kind of thing.
Nope.
They know almost nothing, and that's how almost all of the medications and the drugs work. So I worked on a drug. I worked on JAK2, which is an associated receptor, tyrosine kinase associated with receptors, and it's the receptor. It's the tyrosine kinase for all of the immune receptors, or for most of them, all the interleukins and stuff. And so you may be familiar that most of these things used for autoimmune disease are JAK inhibitors. Well, the JAK kinase family works for all kinds of receptors. So the side effects are going to be shutting down your immune system. Like to have worked on that and then them just trying to take this and use it as this blanket treatment for everything. I was just like, are you kidding me? Like, that is not specific. You can't just shut down this really important molecule that functions with a lot of different systems and think everything's going to be okay.
Right.
And that's why you have these, commercials that, like, yes, this will help you with your eczema or with this or with that. It might also, cause you get a brain infection, your immune system shut down, death, blah, 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 because, like, there's all these unknown side effects instead of supporting your body and working how it was designed to work.
Yeah. Right. Right. And really looking at that supportive therapy, that was one of the things during COVID, and still to this day, getting those letters to say, oh, it's time to take your flu shot. If you don't take your flu shot, you got to wear a mask. I actually have Chris and Megan coming on the show in a couple of days to talk about that again. I was like, I know, girl, we have talked about this so much ad nauseum for 5 years, but it's that time of year again. And we have more people that need to be educated. And I said something, I said, why in that letter are they not saying, hey guys, it's time for flu season. Make sure that you are opening up your windows and increasing circulation and getting outside and, supporting yourself with some vitamin D, some supplements, blah, blah, blah. They don't say that. They don't even mention it. It's just that flu shot is here.
Well, and that's how you know there was some conspiracy. I mean, I was an expert witness, or was going to be an expert witness for Dr. Eric Naputi in court because the government basically sued him for selling vitamin D and zinc. And I was his zinc expert to be like, my whole argument was zinc sufficiency is absolutely critical for immune function. And they kept trying to like get me into these little, rabbit holes. And I'm like, no, it's just that simple. I mean, I can make it a little more complex if you want to, but for the federal government, and they said he was saying it was a cure for COVID, which he never was. But basically, the government's not only saying we're not going to say anything, they're suing you if you are outspoken about selling vitamin D and zinc.
Yeah, it's wild. I mean, when I remembered the mechanisms, I remember it this way, and tell me if I'm correct, that zinc opens up the cell membrane to allow vitamin C and vitamin D in.
No, that's not really how it works. It can open up the cell membrane to, like a zinc ionophore can help, the zinc is really important in turning genes on and off. All right. There are zinc fingers and transcription factors that turn genes on and off. So, and those are critical to immune function of certain genes. So it's critical at a really, really basic level. That you need. So, and then of course, we had like the hydroxychloroquine, and some of these things are also zinc, and quercetin or zinc ionophores, and allow more zinc into the system. And inflammation critically reduces zinc levels. So it's also an issue of context. When you're extremely inflamed, your body goes through a lot of zinc. And there are other things that it's used for, but it's needed at a very basic level to turn on and off genes related to immune cell function.
Mm-hmm. And so basically you want to stop the inflammatory process from happening,
right. And
because every disease.
Zinc, right. And when you're deficient, you can't. I mean, it's just that simple. When you're deficient in zinc, you can't. And the inflammation itself causes a zinc deficiency. So, so, and that was my whole argument, zinc sufficiency. And they're like, well, everyone's zinc sufficient. I'm like, no, and so I just bring up studies, infection reduces zinc levels, inflammation reduces zinc levels. Like, duh, this is not complicated.
It's not, right. And the whole idea of, you don't need supplements, yeah, I mean, I remember hearing that for decades.
Eat every day of your life, and your body would continue to function normally.
Right. All right, let's close out the show with how nurses can help protect parents. Okay, so how would you answer this? How can nurses speak up when the system pressures them to stay silent or complicit?
Well, first of all, I obviously cannot address individual circumstances. But I mean, in hearing a lot of parents, validating the parents. And I can't tell you how many parents have said, I went there, and then when the doctor left, she said, oh, well, it looks like you might have a fever. Maybe you want to reschedule. Or, they sort of validate the parents' concerns, and it can be even in subtle ways. But the parents get the message. I'm on your side. Your concern is real. It almost can even be a look that you're like, you look at them and you're like, your concern is real. And because what I see is the parent is not going to, they're going to say no vaccines, or they're going to limit them. And then they come back and tell me they yelled at me and I caved. Right. So just strengthening that parent, or, when someone's about to take the kid away for the hepatitis B vaccine that, the mother just said she didn't want, just gently intervening with something. And so like, these aren't ways that you have to go to the wall for, because usually that kind of backfires on you. They're just gentle ways to intervene and suggest something different, redirect attention, validate the parents, and know that parents depend so dearly on nurses. I mean, I don't want to see all the nurses leave the system, because most of us, like I have a child that has epilepsy, and so I remember with the mask, being in there and having the nurses just quietly set the mask beside the child, or you know what I mean?
Yeah.
Let it hang down or whatever it is. Meant the world to me. Nobody said anything. They just gently did something and not made a big deal of it, because if they made a big deal of it, then somebody else has to address it.
Yeah. Yeah,
you
I
know?
love that. That's great. And you know what? That's what I teach in the ethics course is that it's actually your ethical duty to say something.
Mhm.
And the code of ethics explicitly states that well, first of all, our number one duty is to the patient. And
Right.
so that means honoring their autonomy, their informed consent, shared decision making. If a parent doesn't want something for whatever reason, it
Mhm.
is the nurse's duty to side with that parent,
Right. Right.
not with the system, not with the doctor, not with the order. I can't tell you how many times I've come out of the room and just, marked off on their, TB shot, I don't even say like refused. I put a little note in there,
Mhm.
wanted some more time to think about it. You know
Right,
what I
and
mean?
that's exactly like the where you're validating the parent's concern without blowing it into a volcano, which it can often backfire. And so there are times to absolutely strongly stand your ground, right? I mean, and obviously, that's going to be situational, but a
Yeah.
lot of the times you can actually stand your ground very gently by, saying, "Oh, like you probably wanted to reschedule, didn't you? Or you wanted to, more time to think about that, didn't you?" Validating the parents'
Mhm.
concerns. Now, obviously, if they want a vaccine, then you just try to give informed consent and let them know if
Right.
you have concerns, which is your duty as a healthcare provider.
Yes. Yeah. And it's actually, I tell nurses all the time, go in the room with the doctor and look at the patient, look at them and hear what he's saying and look at their reaction, and do not let them leave the room until you ask them, like, do you understand that?
Mhm.
Tell me what that doctor just said to you. Tell
Right.
me what he just said, because I need to make sure you understand it. And, at first you may get some pushback from the doctor a little bit, but once they get to know you and know
Mhm.
that you are, your heart is on the right side, right?
Mhm.
That you're not just going there to be, controversial with them or
Right.
anything,
Right. Right.
then they respect it, because they know if a patient feels comfortable in doing everything, then that is their stress response is
Right. Is
lowered,
better. Exactly.
all of it. Yes.
Mhm.
Okay. So what can we say to parents who are terrified to question their providers or who feel bullied into compliance?
Well, find a new provider if you can. Um, and
Mhm.
I think that, just find some like minded people, find someone to come with you. Like a lot of different states have different vaccine aware groups that you can actually call and have someone come to an appointment with you. I had someone actually do that, even to her husband was a doctor. And she said, "Can you put something together?" So I put together some of the science about it, and actually, it blew up into this huge fight between them. But she said, "Well, just read it. And if you still want to vaccinate afterwards, then I will step down." But, he didn't want to blow up the marriage. So he stepped down. And then COVID happened and he completely changed his mind. The doctor
Mhm.
did about, because there was just so much weird stuff going on. So I
Yeah.
think that,
Right. Right. Okay. All
having
right.
someone
Closing up here.
come
For
alongside you.
someone
Mhm.
just beginning to question, where should they start on your website?
I'm sorry, I lost you for a second.
Oh, I said for someone just beginning to question things,
Mhm.
where should they start on your website?
Sure, if you're just beginning to question vaccines, on my childhood vaccine page, right when you get to the top, there is about an hour and 20-minute lecture that kind of is an overview of vaccines, and it's just going to change your perspective. It's really going to really, and I try to do it from a very layperson kind of way. So it's not too deep in the weeds. It's going to really change your perspective and give you an overview of what you need to be concerned about. And then you can start asking more specific questions. I have a page on every single vaccine on the childhood schedule. And then if you want
Okay.
health recovery, regardless of whether it involves vaccines or not, you're going to want to join, because that's what I do. I offer really high level, cutting edge seminars on basically health recovery and things that your doctor doesn't know that you really need to know if you're trying to recover your health.
Right.
Topics like mold and pandas and how chronic immune activation can lead to autoimmunity or even cancer, and how you can walk these things back, because they're not dealing with autoimmune issues. So autoimmune issues are a huge thing that I
Mhm.
deal with for members of my website. Huge.
Huge, guys. And it's $13. It's $13 a month, right, Christina?
Yeah,
Yeah.
because I have all these mothers of kids with vaccine injuries. I just can't, see. I want to make it affordable. And, it's the kind of thing like I'm doing one on do viruses exist tonight, right? That's my topic. And if, you join and if you don't get the link in time, it'll go up next week. So every webinar is then posted to the site to our presentations. But at $13, people will be like, oh, well, I'm just even interested in this one. But you don't just get that one. There are like, dozens of presentations. There's a healing where do I begin that tells you how to detox. There's a page on genetic susceptibilities. There's a page on what all the different tests are and what you might need to get if you suspect autoimmune, if you suspect genetic susceptibilities, all of these different things. So there's a ton of information. It's basically a self-educational resource, and it, it's all broken down for you for members.
Yeah, that's so great and affordable. I know I get a lot of people in my private membership group that say, I'm not always there, but I want to support you. And
I
that
know,
this
and
is
that's the
how,
thing. You're supporting me, and because
right.
I'm really trying to discover the root causes, because I just can't.
Mhm.
We've got to reverse this. Like it's to the point where almost pretty much everybody is sick.
Yeah. Yeah, exactly. I know. I just had a big wake up call when I did a body scan, girl. I was like, oh my goodness, I have got to make some changes and make them quickly. Not
Well,
to
call
say
me,
that
girl. I got you.
seriously, seriously. Oh my goodness. I cannot wait to do another show with you. I am just so honored that you're here, guys. Or
Yeah,
Dr.
there's always
Parks.
so much to talk about. You give me a topic, and I'm.
Yes, 100%, 100%. Well, thank you. All right, guys. I think we learned here today is that courage doesn't have to be loud. It has to be faithful and it has to be actionable, right? I mean,
Absolutely.
it's steady. It's quietly saying, I need more information, even when the world demands blind obedience. If you are a nurse, a parent, or someone just seeking truth, you're not alone. There's so many of you out there. And you know what? And there's power in knowledge, and there is a responsibility to share it. So go to vi-ta.org to explore referenced information on every childhood vaccine and the science that supports true informed consent, and also get some information on how to heal your chronic issues. And until next time, friends, be safe, be well, and God bless.
Shining light into darkness, thank you for tuning in to Nurses Out Loud.